You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with gum disease. When you floss, if your gums bleed, if you have loose teeth or bright red gums, and especially if you have bad breath, you may have periodontal disease. Well, with a new laser and a simple treatment, you can eliminate those symptoms. So my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with periodontal disease. My first guest is an expert on the topic, Dr. Dintcho. Dr. Dintcho, welcome to the program.
Thank you very much.
Now, before we get into today's topic, tell us a little bit about your practice, because you do much more than just periodontal treatment.
That's true. That's true. I am a general practitioner, which enables me to do all sorts of dentistry, which includes anything from bleaching to full mouth reconstruction.
You say you do a lot of bleaching. I guess that's very popular.
We do probably more bleaching than anybody in town, actually.
Is that right?
Yeah.
Okay.
And the reason being is because we were the first office to have the Bright Smile system.
Okay.
And since then, we've kind of gained a pretty good reputation about the bleaching system and have some really, really good results with it.
Now, 24-hour emergency service, who handles that?
Yeah, I handle that, and it's kind of fun sometimes. So you get a call at 2 o'clock in the morning, and I have to go over to my office and do whatever we have to do.
Is that right?
Yeah, we do.
So,
that.
I mean, what's a dental emergency?
Well,
is that common?
Well, yeah, the reason being is because if you go to a hospital for a dental emergency, all they're going to do is give you some pills and some antibiotics and send you home. At least if you come to my office, we'll be able to do something for you specifically that's going to relieve your discomfort.
Okay. You like that, you said.
Well, I do, because
what, the pressure, the excitement?
Yeah, I mean, you have to be a pretty cool cucumber to be doing that kind of thing. And, it can get pretty serious sometimes. It can be life-threatening. People don't realize how life-threatening it can be, and quite often it's very, very advantageous for the patient to get to a dentist ASAP.
Okay, Air Force, by the way. I guess you went to dental school, the Air Force?
No.
After dental school?
No. I went into the Air Force after dental school. I was stationed in the Philippines for 2 years, had a lot of fun, and Air Force was quite an experience.
Back to today's topic, periodontal disease, new treatment options. What defines it? What is it?
Well, periodontal disease is rather rampant in the population. There's probably 100 million people that have gum disease.
Oh, really?
Absolutely.
Now, gum disease and periodontal disease, pretty much the same thing? One's a layman term, one is a professional term, but it all means the same. Bleeding gums and bone loss from around the teeth, which supports the teeth. And eventually, if the bone loss is too great, then the teeth get mobile and you wind up losing your teeth. Okay, 100 million people, you say?
Oh, minimum.
Have it. What are the symptoms? I mean, how do you know you have it?
Well, the symptoms are very subtle in a sense. They're bleeding gums, swollen gums, reddish gums. Gums are really supposed to be a salmon pink color. And
so like red puffy gums?
Red puffy gums.
Is that the beginning stages of it?
That's kind of the beginning stages. That's what we would call a gingivitis, but basically it's a gum disease. And that's where it begins and can last for, patients can have it for 20 years, 25 years, and more or less be unaware or maybe not want to take care of it because they're afraid or whatever reason. But there are plenty of people that have it. And most of it is due to the lack of proper, and that's a very important word, proper home care.
So there's a proper way to brush.
Proper way to brush and a proper way to floss.
Now, you're big on flossing.
Absolutely.
In fact, you're going to have T-shirts made.
Absolutely. We're going to have some T-shirts made. And on the T-shirt, it's going to say that brushing without flossing is like taking a shower and not washing your armpits. Now, that's everyone really gets a kick.
I don't know who would wear that T-shirt, by the way. I don't think anybody would wear it.
There's a lot of strange people in the world. Probably other dentists. I don't know. Right. I mean, I would wear one.
Okay.
But I think it's really very, very important. It's very inexpensive. The benefits are tremendous.
But some people say, knowing I'm going to interview you, and you say that bleeding gums is a big sign that you have this periodontal disease. Right. Flossing, some people avoid flossing because their gums are going to bleed. I mean, isn't it a little bit normal for the gums to bleed when you floss?
No, actually, gums are really very, very tough tissue because they have a lot of elastic fibers in them. So if you're flossing and there's some bleeding involved, well, that means that your gums are still infected. So you really that infection.
So with the treatment, I mean, it goes away?
With the treatment,
stops?
it goes away, yeah. You know, it can return. You have to understand that the gum disease is only preventable. It's not curable. It's very, very important to remember. And preventing and curing are entirely two different things.
So what's changed in the world of periodontal disease over the last 15, 20 years? A lot?
Well, a lot has changed. In the past, what we had to do was use a scalpel and make these vertical incisions in the gum and an incision along the gum line and kind of separate the gum tissue from the bone tissue and get in there and kind of see things directly or see as well as we possibly could. And then we had to kind of scale things and
what, like you're scraping off plaque, or what are you doing?
Plaque and calculus and the toxins that the bacteria produce that are up underneath the gum tissue. But today that's all changed. You know, we don't have to use a scalpel anymore. We don't need the sutures. We have a laser machine that the fiber is only about the thickness of 3 or 4 hairs, and we're able to just go right underneath the gum line. And
it kills the bacteria? What is it?
That's what it does. It ablates or neutralizes or vaporizes the bacteria and the toxins they produce.
Any science behind it? I mean, is this an FDA approved?
There's plenty of science. FDA certified, and it's plenty of science. As a matter of fact, that was the reason why I was convinced to have this technique in my office, because the science was really so good and very, very impressive. So we decided to go ahead with it. We've had it in the office for quite a while, and we've had some very, very good success, very wonderful success.
You say patients are very happy with
this. They're really very happy.
They call you the next day.
They do. They call us the next day, and they tell us that they're in work. They go to work the next day rather than being out of work for 3 or 4 days and being on narcotic pain relievers and that sort of thing. That's all in the past. Perhaps some Advil a couple of times a day for the first or second day, and that's about it.
Okay, so I understand this correctly. Okay, and you're calling it in the past, but nationwide, probably 95% of all periodontal disease today is being treated with, I guess they cut a space around the tooth. Is that right?
Correct.
And you scrape it with a scalpel of some sort?
Well, you scrape it with these scaling instruments. So there's various shapes and sizes and whatever.
So is it a bloody procedure?
It's pretty bloody. You know,
okay, so
it kind of gets reinfected too, you know, as you're doing it, and it's one of the reasons why it swells.
Do they call that root planing? Is that what root planing is?
Root planing, right? Root planing and curettage.
So that's how they treat it.
Right.
Okay, and now with the laser, no more stitches?
No more stitches.
What do you just kind of pull back the gum line?
You don't even pull back the gum line. You know, you pull it back 1/2 millimeter, which only makes enough room for the fiber to pass underneath the gum line and down into the pockets, down into the depth of the infected area.
Okay,
and
you call that the old way, but it's still being done today.
It's still being done today. As a matter of fact, there's only about 700 of us in the country that have this particular laser that I'm using in the office, and I would say that more than 98% of all gum disease is being done the old way.
Okay.
This is actually 21st century dentistry. This is going to be the standard of care.
So if it's as good as you say it is, how come everybody's not doing it? Why aren't all dentists using this laser?
Well, there's a few reasons. There's a few reasons why, and there are some general dentists who don't do periodontal treatment. I have always done periodontal treatment in my office because I know how important it is for the basis or foundation of the health of the patient's mouth. Okay. And so I've always looked around for something that would kind of change the situation. And a few years back I found it, and this laser has a lot of science behind it, certified by the FDA.
To be effective.
To be very effective, yes it is. And one of the other reasons why many dentists don't have it is because it's expensive. You know, it's a $100,000 investment, and we believe in my office that whatever benefits the patient is what we should be doing for them.
Okay.
And we found that this really does do a great deal of benefit.
Okay, so the people that really need this treatment the most, okay, so they have breath problems, bleeding gums, their teeth are starting to get loose. Okay, so they go in and they get the treatment.
Right.
You kill the bacteria. How soon do these symptoms go away?
They go away immediately. You've left the area sterile. You didn't open it up. That's exactly right. You know, you didn't open anything to the mouth. The mouth is loaded with bacteria, all kinds of bacteria, good ones and bad ones.
You said that if everybody knew about this technology, you'd be booked out for 10 years. Every dentist in America.
I'd be booked out even more than that.
I mean, you believe that?
Absolutely, absolutely. You know, with 100 million people out there who are afraid to go or don't go or whatever, even if 10 million people started to go to the dentist, you wouldn't be able to get an appointment for who knows how long.
I'm not an